بسم الله الرحمن الرحيم.
Bismillahirrahmanirrahim. Hope you all are fine. Today we will discuss a medication called valproic acid. It comes in different dosage forms, oral and injectable. There are different scents that depends upon the need of the patient. If we talk about brands, there are different brands in different nations. In case of indication and pathology, this medication is used for epilepsy, prophylaxis of migraines, acute management of mania associated with bipolar disorders. There are off-label uses as well, like bipolar disorder and status epilepticus. In case of epilepsy, the major goal is to reduce the seizure frequency and increase the quality of life. However, in those patients who have one seizure a day and their life quality is not impacted by it, there is no need to use anti-epileptic medication. Valproic acid is first-line therapy for generalized seizure. However, in case of partial seizure, it is an alternative therapy. In case of adults, the initial dose is 600 mg daily with gradual increase of 300 mg until the control is achieved. In case of children, 400 mg per day irrespective of weight with gradual increase until the control is achieved. However, in children less than 20 kg of weight, 20 mg per kg of the body weight per day is the recommended dose, which can be increased to 40 mg per kg per day. If the dose is increased from 250 mg, then it must be given in divided doses. If we talk about generalized and partial seizures, then 10 to 15 mg per kg per day is the recommended dose, which can be increased after 1 week interval 5 to 10 mg per kg per week until the seizure control is achieved. The safety above 60 mg per kg per day is not established yet. In case of migraine headaches, 400 mg to 1500 mg daily, 2 doses is recommended. However, in case of acute management of mania with bipolar disorder, 750 to 2000 mg a day is the recommended dose. The off-label uses are bipolar disorder and emergency treatments of status epilepticus. If we talk about administration, then prolonged release formulations must not be crushed and chewed. However, if you want to switch from conventional dosage form to extended release dosage form, you have to increase the dose 14 to 20%. If telecoated tablets are to be used in half, then they must be given with food to avoid GI adverse effects. Granules are suitable for children and adults having swallowing difficulties. Capsules may be sprinkled on applesauce and pudding. As you all know that valproic acid is a hygroscopic compound, so it must be immediately used after removal from the file. The granule formulations are interchangeable with the conventional prolonged release formulation. Similarly, capsules and syrups are interchangeable on equivalent daily dosage basis. We talk about drug interaction and contraindication. This medication is contraindicated in active liver disease, porphyria and myocardial disorder. Moreover, valproic acid is contraindicated with carbapenem because within 2 days it results in 60 to 100% decrease in valproic acid blood levels. If we talk about dose adjustment, then it is important to note that chloroquine and mefloquine increase the valproic acid metabolism and the seizures frequency may increase. Valproic acid may potentiate the effect of the toxic effects of carbamazepine, phenytoin, zidovudine, phenobarbital. Valproate may reduce the lamotrigine metabolism and increase the risk of rash. The anticoagulant effects of warfarin and other coumarins may be increased while using valproic acid. In this case, prothrombin time must be closely monitored. If we talk about fertility, then testosterone levels may increase in women. However, impaired fertility in men is also observed, which can be reversible after treatment discontinuation. If we talk about pregnancy and breastfeeding, it is important to mention that valproic acid results in neural tube defects while used in pregnancy. There are 9 to 11%, like 5 times higher chances than the baseline rate of 2 to 3% of neural tube defects. If you are planning a pregnancy, then every effort must be made to switch to appropriate alternative treatment. However, in case of patients with valproate exposed pregnancy, their partner must be referred to the specialist experienced in teratology for evaluation and counseling. For the indication of bipolar and epilepsy, women taking valproate may breastfeed their children. In case of warning and precautions, there is an FDA label that HIV reactivation can occur while using valproate. Moreover, this medication is not recommended in female children and women of childbearing age. Pharmacists must counsel the patient regarding the valproate use, and in case of planned and suspected pregnancy, do not stop the valproate at once. Moreover, in case of pancreatitis, you have to discontinue valproic acid. Patients and their caregivers must record the severity and frequency of seizures. There are also chances of weight gain while you are using this therapy. If you have missed the dose and you are using OD regime, then it's almost the time for the next dose. Then take the next dose. And if you are using the BD regime and it is within the 2 hours of the next dose, then skip the missed dose and take your next dose as normal. If you talk about the storage, this medication must be stored at 25 degrees centigrade and must not be refrigerated or freezed. There are different side effects of this medication which can be prevented by regime. In case of overdose, clinical signs will be observed at concentration 10 to 20 times of the maximum therapeutic level. The antidote: hospital management of the overdose must be symptomatic, like cardiorespiratory, gastric lavage, hemodialysis, naloxone, and activated charcoal. In case of diabetic patients, this medication is removed mainly through the kidneys in the form of ketone bodies, which results in false positive results during urine testing of diabetes. Moreover, altered thyroid function tests are also observed while using valproate. In case of exchanging of valproate, the MHRA review of safety in pregnancy of other epileptic drugs has shown that lamotrigine and levetiracetam are safer to use during pregnancy. Moreover, valproate use for bipolar disorder during first trimester cause 5% neural defects. However, carbamazepine cause 0.1 to 1% neural defects. Thank you so much for watching this presentation. If you have any question, please feel free to ask. Thank you.